Craig, there was a discussion yesterday here at the Aeschi West Conference about shame, and there was quite a robust discussion, and you had some thoughts about that from your clinical work, correct, and your research.
Yeah. So in the work that we've been doing, particularly with military personnel, we actually differentiate between guilt and shame, even though we typically use the terms interchangeably in everyday language. Guilt is feeling bad about something that you've done. Shame is feeling bad about who you are as a person. And so guilt tends to be very normative. It's actually very good for social purposes, because if we feel bad about wronging others or doing something that sort of violates a social norm, that helps us to exist as a society. Shame, however, is not always very helpful or normative, because it's a negative, punitive judgment of the self. And so what we have also found is that guilt can become overgeneralized or globalized, where someone now no longer just feels bad about the things that they've done, but now it kind of spreads out to everything about who they are and becomes much less connected to any particular event. And that's where we start to see a lot more difficulties with suicide.
So tell me about how that then relates to suicide risk, how we go there from that.
Right. So what we have found is that so that kind of globalized shame and feeling bad about the self seems to serve as a vulnerability for suicidal thoughts and behaviors. And some of the work that we have been doing, interestingly enough, has found that when we measure shame in certain ways, so we ask suicidal individuals, and we've done this with non-suicidal individuals as well, to rate themselves on what we call suicidal beliefs, which are: I'm no good, I can never be forgiven for the things I've done, I'm a horrible, terrible person. We have found that those who score high on these shame beliefs, we can actually predict suicidal thoughts and suicidal behaviors better, in some cases, than asking them, are you thinking about killing yourself? And so we're hoping to do more research to see, is this maybe kind of a more indirect but more accurate way of being able to detect individuals at risk for suicide in the near term.